And I wanted to just welcome the Petersons. Dr. Peterson delivered me 44 years ago and was our family's family doc for many, many years. And it just feels so perfect to have you here. When I first started in practice, it was so fun to text back and forth, and has been, about patients. I've been in practice for 10 years as a neurosurgeon, and I get asked why neurosurgery. So I wanted to tell 3 stories that I think capture why. And then I'm not going to go through the logistics of a day in the life of a neurosurgeon, but some things that we try to do every day to try to make every day a good day in the life of a neurosurgeon. I met Robert Rask a few years ago, and I asked him what he did for a living. And if you ever picture somebody lighting up, that's what he did. He lit up with a passion that was palpable. And he says, I make custom guitars. And I said, that's amazing. So my son Josh plays the piano, and Josh wanted to learn to play the guitar. So I asked Robert if he would make a guitar for my son. And he said, sure. So I took my son in, not really knowing what to expect. And it was one of the most unique and special experiences I ever had and have ever had with my son. Robert had developed a craft that he could take wood from trees that had died from all over the world and repurpose that wood to create a beautiful instrument that would create music and tell the story of the player. And he did that for Josh. And when Josh went to college, it was the only thing of monetary value that he took with him. After meeting with Josh, I thought, we've got to do this for my mom, who did not play the guitar, but I love my mom, and I owe a lot to her. And so I invited my mom, which I'm going to invite her now to come up and tell about her guitar.
So this is the guitar Robert made me. I went into this little workshop and told him I picked out the wood that I wanted. You're gonna have to hold it for me. And this rosette I chose these colors, and he took it and said to me, okay, tell me about your music journey. And I told him that there were 2 most important people in my music journey, and one was my dad. He was the first, and then the other has been my husband John. And so it took him a while to make this guitar, but when he brought it back, it is so personal to me and so beautiful. He took all the pieces of wood from this rosette in the order that they appear here and laid it all around the guitar and all up over the neck and back. I'm a pianist, and so he took an old piano, and the inside is an old piano board from a 100-year-old piano. And the neck is made out of that wood from that piano. He also inlaid here where the fret marks are. He wanted to put ivory, but you can't get ivory anymore, so these are woolly mammoth tusks, is that right? Where are you? Yes, okay. And so they look like ivory. And then he did 2 things to make it special, exactly special to my story, 2 more things. He asked me what my dad did, and I said, well, he taught at BYU. And he said, well, I don't have any wood from BYU. I mean, he had wood from all over the whole world. But he said, but I do have a piece of wood from a step that was torn down that led into the old BY High School gym down on University Avenue, that's now the Provo City Library. And I said, my dad, before he taught at BYU, was the vice principal of activities there. And we all went to that school, and we all walked on those steps a bunch. So he took a piece of wood from that step and put it up here inside my guitar, and then he carved a creator's circle on it. There's a tree, and there's a lathe. Is that what it's called? Hand plane, okay. Some tool, I don't know what it is, but he uses it when he makes guitars. And then there's a music note. God makes the tree, he makes the guitar, and I make the music. And then I said, if there's something that you could get from a temple, I mean, you can't go rob a temple, but I said something that would signify a temple, that would be nice, because that would be my connection to John. And so he actually had a friend who was the carpenter on some of the projects for the Nauvoo temple, and who happened to pick up a piece of scrap wood and put it in his pocket. And I'll show you where that piece of wood is in just a second. The other part that I wanted to show you is the back. Isn't that gorgeous? He put lace on it and made magic out of the back. And this is the little piece of wood from the Nauvoo temple. Well, from the Nauvoo temple floor leftovers. Anyway, I love it. I think it's amazing. Thank you.
I like neurosurgery because it's a craft that, just like Robert, allows me to be a part of my patient's story. Brent came to me 3 months after I finished my training, 10 years ago. He was a successful person by every measure, written books, had a good job, happy. Over the course of 18 months prior to seeing me, he began a gradual decline. He started doing erratic things. He moved back into his parents' basement. He gained weight. He went out with friends in his robe at night, not understanding why that was inappropriate, or slept in the office. Parents finally brought him in, and he had a 9, maybe 10 centimeter meningioma that had slowly grown in the front part of his brain and was causing these symptoms. This is a problem that cannot be ignored, and for which the risk cannot be avoided. And that is why I do not like neurosurgery. We took him to surgery and took the tumor out, and with my developing skill set, did my very best. Brent texts me every year because he got better and his life was returned to him. And I think that the ability to make a difference in somebody else's life is why I love neurosurgery. I met Scott Perry near the end of residency. We went to Dallas, Texas. We looked at the instruments and the hardware that could be used to put in people's bodies for spinal fusions and disc replacements and other spinal procedures. And it was a good visit. I was a little bit underwhelmed by the hardware itself. The company has since gotten a lot better. and it's been very good. But what I was so impressed with was Scott. And I remember sitting in the hotel room just talking to him, thinking, I really like this guy. And we have since worked together for 10 years. He's in the operating room with me every day and brings a positive, vibrant attitude. He's always prepared. I love neurosurgery because of the relationships with the people I get to work with. And he's just one of the very first of those relationships that have been fostered and created since starting practice. And that has made such a difference to me. I don't think I was born with a passion for doing craniotomies. I didn't even know what that was, right? And sometimes the idea is that you follow your passion. I think, though, a craftsmanship mindset, find something that you can do that's unique and valuable and use it to make a difference and love and serve those that you work with, and your passion will follow you. So how do we make every day a good day? Tom Hanks was on set one time. He tells a story, and they were not doing very well, and the director just threw his arms up and he said, you guys need to know 3 things. You gotta be on time, you need to know the text, and you need to have an idea. And Tom went on to say, that's great life advice, and it is. It's also good advice for a physician, for all of us. I have a habit the night before of reviewing the surgeries I'm going to do the next day, or maybe it's clinic, or whatever is on the docket. And then I like to show up on time. In the interim between when I review the cases to the time I'm walking into the operating room, when I'm driving in or taking a shower, the ideas have come, ways to get a little better, that incremental improvement, that 1% better. I have an idea. When we walk into the operating room, I feel like, or any clinical situation, we want to give our patients our full attention. On Thursday, during the shooting at Utah Valley University, I was in the operating room and the on-call neurosurgeon at Utah Valley Hospital. We didn't really know anything about what was happening. There was also a code called on a patient in the PACU. I had a patient in the PACU and later learned it was not my patient. But I have learned that when we are in the operating room, I put my phone down, because the only thing that matters is what we are doing in that moment. The thing that we can give our patients that is so important is our complete and full attention. Before the execution phase of any operation, including a surgical operation, doing a timeout and pulling everybody together to remind ourselves of why we are there and what we are doing. And then immediately following the operation, or whatever it is you're doing, the execution phase of it, doing a debriefing, is such a valuable way to ensure your best outcome, your best performance in the moment, and to ensure that you get better the next time you do it. And it's been such a good thing. I think the hospital systems have done a very good job highlighting this, and it's a very, very good principle. When we were in Oregon, we went on a zip tour. Lindsay set it up. We had no idea how good it would be. We were a little bit unsure when we pulled up. It was fantastic. The very first 20, 30 minutes of this zip tour was a lesson in safety. And they had these two carabiners attached to cords that attach to our harness. And it was a one strike and you're out. If you touch those, you're done. Absolute 100% safety. The only people that touched those were the guides, and they would take one off at a time so that we would always be clipped in to our safety line. One of the things about safety is it is a absolute unifying principle in medicine. We can all agree we want our patients to be safe. In the operating room, after our timeout, we have this opportunity to almost like do a second timeout. We put a needle into the disc space or a pin in the vertebral body as a marker, and we get an x-ray. I ask everyone in the room, what level are we at? And if there's a student, I ask the student, not that I'm trying to pick on them, it's because I need them to know they should speak up and be included as a part of our safety culture. We also went river rafting when we were in Oregon, and I thought about how this team of people is in a raft going down a river together. There's smooth water, there's faster water, and then there's these rapids that you have to be careful on, and how it represented, in many ways, what it's like to work in the operating room. Everyone needs to work as a team. We had to learn how to row forwards, we had to learn how to row backwards and in sync with each other. We needed to know how to hold on but still control our paddle, etc., etc. When we entered the Class 4 rapids, we also needed to be cool, calm, and collected in that moment. Not like the lady that the river guide told us about that did not do that and got flipped out of the boat. I want to tell one story about how poise is also a team effort. I was operating with Brandy, and we were doing a revision lumbar fusion. I knew it would be difficult because of the scar, and the patient was a little bit older, and I was really worried about causing a spinal fluid labor tearing dura. We got the nerve free. All was well. We had put our screws in, and we needed to get into the disc space to complete the fusion. Under the microscope, with what felt like 2 billion people watching, which is really just the people in the room, the dura all of a sudden exploded. And there was a student in the room that said, "Why are there spaghetti noodles all over the microscope screen?" The nerve roots had come out of that dura, and that's all you could see in the field of view. No normal landmarks, no dura, no bone, nerve roots. Probably the most dire situation in spinal surgery in the low back that I can think of. And my heart rate went from 52 beats per minute to 173 in about half a second. And it was racing. And I did not start yelling, which would have ruined everything. But I really had a very hard time figuring out what to do. And for about 30 minutes, I could not understand what had happened. But everyone else in the room recognized that I was in this moment. And they just helped me. And a lot of it was actually just helping me sort of relax, be still, take a step back, and reassess. I was able to calm down after my initial attempts to repair or make better the situation. And I had the impression when I was finally a little calmer that my assumption about what had happened to the dura was wrong. So I reassessed, and what felt like the dura exploding, it was really a small hole where it was the weakest by the scar tissue. And the nerve roots come out as a loop, not as an end, right? So 3 nerve roots had come out as a loop, which which looked like 6, which looked like all of them. So that was good. I knew that I could see where they were coming up. I couldn't get them back in. I could not figure out how to get them back in. And again, that calmness that was given, that calm energy really, that was given to me by the people that were with me, that we had done all of these things with, in that moment helped me to recognize and have an impression. You need to raise the head up and roll the patient away from you. And I thought, well, that doesn't make any sense, but I did it. And gravity pulled the nerve roots right back in to the sac of fluid. Then there was nothing to sew. The dura was so thin, it wouldn't accept a stitch. And again, in that calm frame of mind, I put a stitch in to whatever I could get a hold of. And it didn't close the dura, but it created a buttress that perfectly held a patch that sealed the leak. Randy and I went and checked on her. Can you move your legs? Yeah, my legs feel great. And she had no nerve injury. And we later did a lateral fusion where we did not have to deal with the scarred dura. And she was discharged from the hospital. And, you know, back to the big tumor, we can't avoid the problems that come to us. And we can't avoid always the risk. It's the hardest thing about neurosurgery. So when Tyler called me a few weeks after this, he always just calls me when there's a problem. He's since tried to call me when there's not a problem. And I didn't answer. And then he FaceTimed me, and that was like alarm bells going off, right? And something must be wrong. He's ready to show me a scan of some terrible problem. And he had FaceTimed me because this particular patient was in clinic with him and wanted me to know she was doing great. Being cool, calm, and collected and having poise is a fundamental in all of our practices, and especially in neurosurgical care. Those of you that have been in the operating room with me will hear me say, best day ever. And it's not toxic positivity, although I do like the optimism. But if we strive to make incremental improvements day in and day out, 1% better, as we hone our crafts, as we seek to make a difference, and as we love and serve those we work with, every day can be the best day ever, because we can actually be a little better than